Okay. Good morning, dear colleagues, and thank you for taking the time on this Monday morning to participate in our webinar on Taking Resilience to the Next Level, Obesity in European Health DataSpace. This is a joint meeting between the Open EU and the MEP Interest Group on Obesity and Health Systems Resilience. It's great to see so many people registered this morning. It's also very nice to see such a wide range of participant profile, which is on the next slide. So this will show you the kind of participants we have today. So we hope to have very stimulating and interesting discussions amongst the group. I'm not chairing the meeting today, so it gives me great pleasure to hand the floor, the virtual floor, to my great colleague, the EASO policy lead, Jacqueline Bowman-Bussato, who is going to take you through today's agenda and introduce the speakers and give you some essential housekeeping. So thank you very much for participating again. And Jacqueline, I hand the floor to you. Thank you.
Thank you so much, Ewan. Good morning, everybody. It is an absolute pleasure to be welcoming you all, and particularly our co-hosts of the meeting, MEP Pernille Weiss and MEP Susana Solís Pérez. A very big welcome and thank you for being such great champions of this cause. I'm going to run through the agenda very quickly. If you want to see more detail about each of the speakers, you can do so via the event page on the MEP Interest Group webpage. So at the moment, we're going through the welcome, and then we're going to move on to setting the context, resilience, obesity, and European Health DataSpace. So I'll present the Open EU stakeholder view on what we believe could and should be in the upcoming legislative proposal. Then we move into the first discussion, which will be chaired by Susana Solís Pérez on connecting the data dots at 2.0, and joining her around the table will be Michele Cecchini, who leads public health at OECD, along with EASO's Jennifer Lynn Baker, and Open Spain, as well as the patient organization for Spain, Federico Luis Moya. And then Pernille Weiss will also be participating in that panel. We'll then also move on to the second discussion, which is what's next for obesity and European Health DataSpace at the European Parliament. So really, what should be the MEP interest group's call to action? So there, our chair of the interest group, Pernille Weiss, will chair the session, and she'll be joined by Kremlin Wickramasinghe from WHO, Birgit Bauer from Germany and TEDAS as well. And also Susana will be bringing points from the first panel through and working out, together, where do we go from here as an interest group. And then Pernille and Susana will round up the morning with next steps that we know about already from an interest group perspective, as well as what they would take immediately from this session. Next slide, please. So a tiny bit of housekeeping is also important here. So today we're online for this session for 1.5 hours. We will finish on time. So, but, and a very big but, everything is being recorded, and also we will have simultaneous interpretation in both English and Spanish. So reminder to all speaking, when you're speaking, don't speak too quickly because we have 2 amazing interpreters online. For those of you who would like to listen in Spanish and or English, please look to the far right of your dashboard for the Zoom screen, and you should see an interpretation button. You can choose English or Spanish, and you will hear the rest of the meeting only in those languages. Please tweet. The hashtag is hashtag EHDS and #obesitypolicy. And the two handles are EU Obesity for the interest group and Open Obesity for Open EU. Next slide, please. And so we move on to our first word cloud as we get ready for the presentations. So the question is, if you go firstly, if you go to slido.com, #088592, you should be able to start seeing the word cloud form. And the question that we would like to ask you throughout, and please ask questions in the chat, in the Q&A as well. What do you see as the biggest challenge related to data on obesity in Europe? If you wanted to be able to implement obesity as a chronic disease, what first comes to mind? And I see the words start to come in. Thank you. Relevant data. I have a list, but I have to remain neutral throughout this. Great. Opportunity to access data. Standardization. Well, I think we have good news for you. I think we'll be discussing some of those points this morning. Yeah, changing definition of obesity, access to primary healthcare. Great. Keep on going, because we're going to come back and check on the word cloud a bit later in the session. In the meantime, I'd like to bring in, next slide, please. I'd like to bring in properly and introduce our two co-chairs of this meeting. So MEP Pernille Weiss from EPP and Denmark. And she is the chair of the MEP interest group on obesity and health systems resilience. And also MEP Susana Solís Pérez, who is from Spain, and an MEP from Renew Europe group. And she's one of the vice chairs of the interest group. Welcome. In the interest of time, I will say both of you are amazing champions, both with a very passionate interest and in implementing obesity as a chronic disease, and have both been raising the profile extremely well, both within your national member states, as well as within the European Parliament. Pernille coming in with a healthcare background and interested in resilience and sustainability. And Susana coming in with an engineering background and very much interested in infrastructure, how this will work for rural as well as urban communities as well. So I give you both the floor to give your official welcome.
Thank you so much, Jacqueline, and welcome all. I am Pernille Weiss, and I was just running through my mind for how long have I actually worked with healthcare and politics. And I guess actually we have to go back to when I was 19 or 20 years old, starting on nursing school back home on Funen, the little island in Denmark, where I also joined the Danish Nurses Association while I was still learning to be a nurse. So it's very, I'm very happy to be here today to combine my now full-time occupation as member of the European Parliament together with Susana, building on my experiences and knowledge on healthcare, and also in the platform of what we are facing right now in history, and also on the EU platform, namely that the coronavirus very, very precisely have demonstrated for us that we need to build up our resilience in healthcare systems and beyond. But also that we now in 2022 are in the situation where we know that the member states, they have requested to get their part of either grants or fundings to do the digital resilience of their country. And therefore, now that we know that money are going to the member states, it is very timely that we will very soon get the proposal for the legislation framework for the health data space coming from the Commission. And that is why it's so valuable that all of you are here this morning, because we need to get started to gather the inputs from stakeholders, because otherwise the health data space will not be made with the architecture and the needed output that we want to be able to work on the European health resilience, and especially on the agenda on obesity. So welcome so much. I hand now over the floor to my dear colleague Susana, whom I can see is actually in the parliament in Brussels. I'm in Copenhagen this week. So nice to see you, Susana.
Buenos días, Pernille, buenos días a todos. Es un placer, yo tengo que decir que es un placer trabajar con Pernille, y además lo bueno es que como tenemos diferentes perfiles, yo no tengo un perfil sanitario, pero sí nos podemos compenetrar mucho mejor. Y lo primero de todo, dar las gracias a todos los que han participado en la organización de este evento, porque como decía Pernille, estamos en un momento adecuado, ¿no? Tenemos ahora una oportunidad única para posicionar a la obesidad entre las prioridades sanitarias europeas. Y a mí me gustaría comenzar recordando unas cifras que a mí me han impactado. Los datos actuales estiman que el 23% de los adultos europeos padecen obesidad y que un 36% adicional padece preobesidad. Es decir, estamos hablando que el 59% de los europeos estamos afectados de una forma u otra. Es la cuarta causa independiente de mortalidad prematura y su tratamiento consume alrededor del 7% de los presupuestos nacionales cada año. Por eso creo que estos datos tan evidentes han hecho que la Comisión haya reconocido a la obesidad como una enfermedad crónica no transmisible. Pero todos sabemos que hasta que no esté en los planes nacionales y que no se reconozca como tal, los sistemas sanitarios no van a destinar los recursos necesarios para prevenir y tratar esta enfermedad adecuadamente. Yo creo que no podemos seguir haciendo la vista gorda, tenemos que actuar. Yo creo que esto es como una pandemia silenciosa y lo que nos faltan son datos, ¿no? Después de hablar con muchos de vosotros, recopilar datos a lo largo de la vida de las personas que padecen obesidad es esencial para permitir el tratamiento y sobre todo para la investigación. Así que ahora que estamos en el despliegue, en pleno despliegue del el espacio europeo de datos sanitarios, tenemos que actuar con rapidez y asegurarnos que la obesidad no se queda atrás y está bien contemplada en este espacio europeo de datos. Así que a mi entender lo esencial de esta sesión de hoy es inaugurar un debate que nos permita identificar las prioridades, las necesidades más acuciantes en este sentido y que hagamos de la obesidad una prioridad aquí en el Parlamento Europeo. Contad con nosotros, contad conmigo, contad con Pernille y encantada de participar en este debate de hoy.
Wonderful. Thank you so much, Susana. Moving on now then to the one and only presentation, which is setting the context, resilience, obesity and European health data space. Next slide, please. So EASO not only coordinates the expert secretariat for the MEP interest group in obesity, but we also coordinate the expert secretariat for Open EU. Open EU, so the Obesity Policy Engagement Network, was established in March 2020, literally as we were going into the first COVID lockdown. So that was very interesting indeed. We are a multi-stakeholder coalition striving for the implementation of policies and frameworks that can positively impact a whole systems approach to obesity treatment and long-term management. And that point is key because what Open EU works on are 4 key pillars, which is about raising awareness of obesity as a chronic disease, education, for not only for healthcare professionals, but all actors that can have an impact on implementing obesity as a chronic disease, sufficient resources, and they're not just money, or should we say financial resources, but also infrastructure, all of the things that we're about to talk about this morning, in fact, and the establishment of and access to multidisciplinary centres of excellence, or centres of obesity management. Next slide, please. We're part of a global community. I won't go into details, but as you can see, there are regional hubs such as Open EU, as well as across different countries. And EASO is one of the founding partners at global level as well. Next slide, please. So a quick reminder, because resilience is top of the agenda for absolutely everybody. So in 2020, the European Commission said very clearly as part of its strategic foresight report that there's a need to better anticipate risks and prevent the spread of new infections and associated disorders. So again, mention of COVID-19, but what was really important here was that for the very first time, the European Commission put obesity as an NCD on the same level as cancer. So not a risk factor, not a lifestyle choice, but actually really aligning with scientific consensus and saying, what do we need to do that, yes, prevention in an ideal world, but what do we do, as with other NCDs, other non-communicable diseases, for the treatment, long-term management and control? Next slide, please. Now, we then take that and transpose the European Commission's foresight report of 2020 into the world of resilience. And again, very clearly set out by WHO EU Observatory and taken up by the European Parliament, amongst others, to have 4 main blocks of financing, governance, service delivery, and resources. So again, many of the pillars which keep on coming back in terms of how do we look at this through the lens of obesity in order to actually build that resilience. Next slide, please. So in the context of EHDS, so European Health DataSpace, from an Open EU perspective, we actually identified a number of major challenges related to data identification, harnessing, and usage, both primary and secondary. And what it boiled down to was that to be positive, we now have a major opportunity to address some of the significant gaps in terms of building resilient health systems and integrating these elements into the European Health DataSpace strategy, planning and implementation. Because currently there is no systematic opportunity for early diagnosis or even systematic recording in an electronic record beyond BMI. And as many of us are already aware, that by the time someone presents with excess weight, actually the biological disease progression is quite far progressed, and a lot could have been done prior to that. There's no consistent, standardized or federated data collection beyond prevalence. We're going to come, I think, to Michele on all of that. There are no linkages, so no linkages are made within the national health surveys into or other EU level statistical data in terms of severity, long-term progression and treatment of obesity. It's all on prevalence of a snapshot of BMI. There's no ongoing data interlinkage with the 230 plus direct medical complications, both physical and mental, of obesity as a chronic disease. And here I would highlight 11 cancers, cardiovascular disease, 80% of type 2 diabetes and respiratory diseases. It's quite shocking when we read the list. And in the case of obesity in particular, where the vast majority of long-term management and self-management interventions are carried out outside of primary care services, there's no harmonization of real-world evidence reported. Next slide, please. So in a nutshell, there are three main areas that our policy stakeholder views paper focuses on, and that is governance, where we strongly believe that there is an opportunity to address in particular GDPR and data flow, data quality and interoperability, and here we cannot emphasize enough the opportunity to establish obesity national plans based on meaningful data, and then infrastructure and technology. Next slide, please. I won't go into all of this slide. I just wanted it here so that when you go back, you can see and also go read the document. But it basically falls, governance for us and the needs fall into two camps: building capacity of the different stakeholders to be able to collect the data, collect standardized data, share standardized data, and also key a harmonization of metadata and related coding for all health professionals. If we do not have stakeholders who have a common language, both in terms of vocabulary as well as jargon across different countries, if we do not meaningfully engage those who need to implement a lot of these networks and frameworks at regional level, if we cannot actually provide transparent access to data by all stakeholders, and if all stakeholders do not have health literacy, the frameworks that we put in place will remain meaningless. Next slide, please. And that's when we move on to data quality and interoperability. For us at Open EU, again, national plans, this is a key opportunity to do so, because we need to make sure that obesity is able to be recorded beyond BMI, so things like insulin resistance or other biomarkers, that obesity treatment and long-term management can actually be included in existing EU-wide infrastructures such as My Health EU infrastructure that we know the Commission is thinking about already, ensure that there is interoperability, or at least, shall we say, connectivity between the data collected for obesity and comparators within the other 230 plus medical complications of obesity. And that efforts can be made to collect and connect health and disease progression data for obesity. So go beyond prevalence, it's a snapshot. We really call for almost a disease staging framework approach to measuring and collecting data on obesity. That that data is medical quality regardless of provenance, and that there's inclusion of real world data. Next slide, please. So moving on from there, what we hope that will boil down to in terms of infrastructure and technology is that we'll be able to see registries on obesity, and also inclusion of obesity as one of the priority NCDs within the European Commission's just launched Healthier Together EU Non-Communicable Diseases Initiative. This is not pie in the sky, so to speak, at this stage. We're in the real world, as Pernille quite rightly said, of the dossier coming to the Parliament. This is our opportunity. The obesity community, or those who can have an impact on health outcomes on obesity within the Open EU network, are very clear that it would be extremely helpful to have these points taken into consideration. Thank you. I'd now like to hand over to Susana for the first panel on connecting the data dots 2.0. Susana.
Muchas gracias por ese estudio tan interesante, donde vemos que queda muchísimo por hacer en términos de datos. para tener datos que podamos medir y que sean confiables y poder tratar a la obesidad. Y bueno, pues empezamos ahora con este primer panel y tengo que decir que es un lujo poder contar con expertos como los que tenemos hoy aquí para que nos ayuden a identificar precisamente cuáles son esas barreras y esas necesidades. Yo les voy a hacer una primera pregunta común para todos vosotros y os pediría si podéis contestar en menos de 2 minutos para poder ajustarnos al tiempo y que luego tengamos tiempo para todos. Me gustaría escuchar específicamente de vosotros desde vuestra perspectiva como generadores o bien como usuarios o bien como consumidores de datos. ¿Qué consideráis necesario para que los datos puedan ser aprovechados en este contexto de la obesidad como enfermedad crónica? Michele, Cecchini, de la OECD, adelante, encantada de que estés con nosotros.
Hello, good morning, everyone. It's a pleasure to be here with you and discuss about this tremendous opportunity that the European Health DataSpace can offer. In my professional capacity, I'm both a data generator and data user, but as an EU citizen with high cross-country mobility, I'm also a future consumer of the health data space, European Health Data Space. But let's stick to my professional activities. The work of the OECD is to help countries, including EU member states, to put in place better policies for better lives. My team and I decline this in promoting better public health policy for healthier lives. Most of our work is really to identify and collect the national data, make this data comparable, as in the case of publications such as Health at a Glance, and then draw policy implication on this data, as in the case of analytical publication. Clearly, by easing access to health data, the European Health DataSpace has an enormous potential, as it can significantly increase our possibility to provide timely advice and the speed of which we can provide this advice. In term, and I'm finishing my first answer, in terms of what I need to get out of it, my wish list includes 3 main things. The first one, comprehensiveness, both in terms of the type of data that is collected by the data space and the geographical scope of this data, because we want to compare as much as possible across countries and for as many data as possible. The second one is the possibility to link the data with other data sets, including health data, but I would stretch this beyond health data. Third, as a citizen, I have a concern on data safety and security, and I think we should also pay attention to this dimension. Over.
Muchas gracias, Michele. Adelante, doctor Jennifer Lindbaker. 2 minutos para tu primera reflexión.
Great, thank you. It's a great pleasure to be here today. I'm here as a data user. I've been working in the field of obesity research for 25 years now. So I have a great concern about data quality. And what I see is that this is going to create a great opportunity for us to really reshape how we view obesity. If we view it through the lens of being a chronic disease, a chronic relapsing disease, we can take this and we can form which data we wish to collect. Because unfortunately, as it stands, the one big challenge in obesity is we lack data. So my 3 wish lists, if you will, number 1, I want to make sure we're regularly, routinely collecting this. If we view obesity as a disease, this is an absolutely common medical procedure. Furthermore, I want us to go beyond just BMI. My second wish is that we are able to collect things such as body composition or other biological markers, because these are what is going to give us the greatest insight into how obesity is developed and how it may be progressing. And thirdly, I want us to really dig deeper and to really figure out and measure and record consistently and carefully when, how, and how the disease is progressing. If we view obesity as a chronic disease, we have a lot of comparative frameworks we can use. We can look, for example, at how cancer is treated and viewed across the European Union. It's regularly recorded, there's registries, there's cross-border sharing, so we know this is possible. So going forward, I think this European Health DataSpace is a great opportunity to achieve this for obesity. This will benefit the patients and society. Thank you.
Muchas gracias. Ahora es el turno de Federico, de la representación de los pacientes de Open Spain. Federico, ¿cuál es tu opinión en estos 2 minutos?
Buenos días, lo primero, y encantado de estar participando y que se empiece a dar más voz a los pacientes, puesto que, bueno, nosotros somos generadores de datos, como es evidente, y vemos la necesidad de que esos datos, bueno, como si dijéramos 2 puntos, en mi caso son 2 puntos. Uno, el codificar una estrategia conjunta, que todos mantengamos una misma pauta, una misma forma de codificar esos datos o de hacer esas preguntas de una manera que sean todas iguales, que los datos sean recogidos claramente basados en la ley de protección de datos, como tiene que ser, porque no hay otra manera. Y una es la necesidad de que la participación de los pacientes dentro de los grupos de investigación, las sociedades científicas, que también sea una participación y que sean unos datos fáciles de lectura y de comprensión por los pacientes, puesto que cada vez hay más pacientes que quieren saber y que quieren conocer sobre su patología y necesitan que sean datos fáciles de comprender y entendibles para todo el mundo.
Muchas gracias. Pernille, como policy maker, ¿qué pedimos?
Yes, thank you.
También necesitamos datos, ¿no?
Well, yes, we do, because both you and I and all our colleagues in the European Parliament, we are actually data users, because I think that we are in an era in European policy where we know that we need to be more evidence-based in our policy making. So for that, the data on obesity and health resilience is very, very important for us to direct our legislation, but also the funding that we have in our hands to direct. Two specifically topics that I know that we will need this database to guide us is, of course, the upcoming semester checkups of the member states staying on track, not only on their economy and growth, but also in their health resilience from now on. Because we saw, as I said in the beginning, that we are not strong enough to push back on every level when it comes to an epidemic, or in this case, a pandemic. So we need the database to guide us in the semesters, which is the annual checkups of each member state and how they're doing, also in relation to healthcare. And secondly, also the database will be very useful in the upcoming revision of the legislative tools and platforms that carries the pharma strategy of the Union. Because I want, and I know that many of my colleagues also want, the EU to be the most wanted place for the life science and pharma industry to live and to develop their businesses. Also because that is very, very important for the resilience of the Union, that we do have the industries needed to provide us with whatever we need to protect our health and also to develop our health and life quality for European citizens. So I can see that both in terms of the semester and the strength of the Union, but especially also to support the guidance of the best possible policy tools to make the pharma strategy actually to give the payout back to the citizens in order of innovative and research-based, very precise medicine and life science in the future. Thank you, Solís. Oh, Susana, sorry. Susana, back to you.
Está claro que necesitamos datos, que estos datos tienen que ser, como habéis dicho, de calidad, que se vinculen con otras enfermedades, que sean capaces de vincularse con otras enfermedades. Por supuesto, tenemos que contar con la seguridad de los pacientes y la privacidad de datos, y que, bueno, pues no solo necesitamos datos con otros marcadores biológicos y que se puedan, como decía Federico, codificar, armonizar y que sean sencillos, ¿no? Michele, la OECD y otras grandes organizaciones internacionales, como la Organización Mundial de la Salud, producen inmensas cantidades de pruebas y de datos, ¿no? Y este año, por primera vez, el informe Health at a Glance de la OCDE contiene secciones separadas sobre dieta y actividad física y sobre peso y obesidad, tanto para niños como para adultos. Yo creo que esto en sí ya es un gran paso adelante en el tratamiento de la obesidad como enfermedad crónica. Mi pregunta es, ¿qué le ayuda a ustedes como usuarios de datos a proporcionar pruebas y vigilancia a largo plazo de acuerdo con esta definición de la Organización Mundial de la Salud y de la Comisión Europea de la obesidad como una enfermedad no transmisible y como gateway a otras enfermedades? Desde su punto de vista, ¿cuáles son los obstáculos actuales para lograr esta evolución?
I think that there are a number of things that we could do better, but let me focus on few for which I think the European Health DataSpace can play a key role. The first one is that fundamentally today we focus only on surveillance related to prevalence of obesity, fundamentally the number of people with this condition. But it is key to gather information on additional dimensions, such as, for example, what is the prognosis of people that have obesity, fundamentally similarly to what is done already for diseases such as cancer. What is the impact on quality of life of these people? What care do these people receive for obesity as well as other conditions? What is the cost of this care? And trying to link the interventions the countries put in place to levels of obesity and the quality of life. The second area in which I think we can do better, and this would improve our ability to provide advice on this, is that we need to switch to measured data rather than a mix of self-reported and measured data, which is one of the greatest barriers to compare across countries. Finally, number 3 is that we need to increase granularity of the way in which we gather this data, as today we struggle to understand patterns for specific population groups beyond, for example, data by gender or broad age groups. For example, we want to have information on subnational levels, educational level is in my wish list, and for example, ethnicity. In this light, I think that proposal of OpenEU of systematically recording obesity data in electronic patient records is certainly a proposal that would favor step in this direction. Thank you.
Muchas gracias. Una otra pregunta, Michele. Vosotros, hay países que ya han reconocido la obesidad, ¿no?, como enfermedad crónica. Estamos hablando del caso de Portugal, de Alemania. ¿Cuáles son algunas de las estadísticas de los beneficios donde esos países qué podemos sacar? ¿Cuáles son los ejemplos que podemos obtener de estos países que ya lo han hecho?
Well, certainly the decision of upscaling action against obesity, including the direction that you have mentioned, provides the basis for a more thorough collection of data and understanding of the underpinning causes of this condition, as well as of its consequences. We believe, I think, that what Germany and Portugal have done, but also beyond these other countries are thinking to do, is a right step in that direction, and can help us understanding better what are the costs, for example, related to obesity. We know that, for example, today, more than 10% of healthcare expenditure in Germany and Portugal is spent to treat this condition. As well as the impact, for example, on labor force productivity and the broader economy of these countries.
Muchas gracias. Una pregunta, mi pregunta para Jennifer. Como epidemióloga, especialista en Big Data, ¿no?, en investigación sobre la obesidad y en vínculos con el cáncer, ¿cuál es su mayor reto actualmente sobre el uso secundario de datos, sobre todo en el contexto de cross-border, en el contexto transfronterizo? ¿Y qué podríamos aprender de otras enfermedades crónicas importantes que se han apoyado ya, como el cáncer y la diabetes? ¿Qué podríamos aprender de ellas?
Great, thank you for those questions. I mean, I think the biggest challenge is, and what I think the European Health DataSpace can help us do, is resolve some of these issues surrounding GDPR and finding a harmonized framework which can ease the flow of data across borders. We do have larger data repositories where this does successfully occur. For example, there's a Nordic Cancer Registry where each country deposits their data into this. So we have ways in which this could go. But as I'm speaking, you can hear it may take something at the European level to help harmonize this. So I think with the European Health DataSpace, this is another opportunity to sort of establish these centers that can help manage and flow the data to the people who need them when they need them. And this also includes the patients. For the second part of your question, I think, from my experience anyways, in the field of cancer, there's a great amount of experience in how to establish these national registries, how to harmonize the data collection, how to actually ease the data access. So I think rather than having to reinvent the wheel, we can take a look at some of the work which has already been performed and really learn from that. And of course, we can always enhance it to suit the needs for obesity research. And as Michele was saying, and I couldn't agree more, it's really important as we're going forward, we include the patient-reported outcomes, and that, as Federico was saying, that we make sure that these data are accessible and understandable to the patients as well. And I think this is a great opportunity we have. Thank you.
Muchas gracias. Federico, tu experiencia como paciente. Antes nos decían en el chat, algunos de los participantes, que efectivamente, como tú habías dicho, la participación y la relación multilateral con los pacientes es esencial. A mí me gustaría preguntarte, porque en España, igual que en otros países, la asistencia sanitaria se gestiona a nivel regional. Me gustaría saber cómo afecta esto a los pacientes, ¿no? Cómo puede afectar en el tema de la obesidad, esta disparidad entre las regiones. También entre las zonas rurales y las zonas despobladas, porque hay varios estudios que publican que la obesidad tiene un mayor impacto en las zonas rurales que en las ciudades. ¿Y cuál dirías que es el mayor reto para el acceso a los datos?
Bueno, pues como tú comentabas, un poco hay disparo porque el problema es que, como sabemos y en otros países pasa, hay un ministerio central y, como tú has dicho, hay 17 de diferentes regiones. Entonces, cada gestión se lleva de una manera. Luego también, por ejemplo, de donde yo vivo, que es Santander y Sevilla, aquí no hay unidades multidisciplinarias y en Sevilla sí. Pero en una misma región, en menos de 100 kilómetros, hay un hospital que tiene unidad multidisciplinar, que es la que se debería de proponer para que los pacientes reciban el mejor acceso al mejor tratamiento de la obesidad y con la última evidencia médica. Y en otro de menos de 100 kilómetros no hay unidad multidisciplinar, pero se opera obesidad o se trata la obesidad, que al final la operación es como el último paso dentro del tratamiento. ¿Esto cómo afecta? Pues que dependiendo del hospital que te toque, tienes un mejor tratamiento o un peor tratamiento y a su vez y igualmente acceso a más datos o a menos datos relacionados con la obesidad. ¿Por qué? Porque sabemos que la unidad multidisciplinar trabaja todas las patas que tocan la obesidad, como hemos dicho, más de 200 enfermedades, comorbilidades, y simplemente problemas de que es más fácil tratar, entrar en un hospital y que desde que tú entras te gestionan todas las citas, a en otro hospital que no se opera obesidad, pero no hay una unidad multidisciplinar, lo que conlleva que de operarte como muy pronto en un año podemos estar hablando de 4 y 5 años de espera para una operación o para un tratamiento, puesto que no hay una unidad central.
Esto es clave, ¿no? La disparidad que puede haber, no solo en Europa, sino también dentro de un mismo país. Mi última pregunta para Pernille, porque nos quedan 2 minutos y quiero ser muy justa con el tiempo. En Dinamarca, donde la prevalencia de la obesidad es en el 20%, mucho más bajo comparado a la media europea, ¿cuáles son las cuestiones más importantes que hacéis frente allí? ¿Qué ejemplos nos podéis dar?
Pernille, you're on mute.
Now something came up on my screen. Thank you so much. I didn't know I was unmuted. Sorry. Thank you for the question, Susana. Yes, what I really hope will happen very soon in Denmark is that both the Clinic Society of Family Doctors, but also all the different multidisciplinary stakeholders within health science will be more aware about the need for the data. For them to address both the resilience of the Danish population, but also in order to make it more visible how the clinical output is interlinked with the health system architecture. And that is also what I think we as politicians in the upcoming work with the health DataSpace must be very aware about, that the database must provide us with clinical data and make them useful for clinics, for the healthcare specialists. But also the database must provide us with the ability to understand why are the data showing indifferences between countries and groups of families, groups of patients and citizens. Because otherwise we will not understand why that the prevalence of obesity and pre-obesity is different from each member state, which I will expect them to be, also because as Europeans we are a lot alike, but we are also in difference. And that is actually the strength of Europe, that we are 27 different member states that can always learn something from each other and play each other strong as a whole community. So I hope that the DataSpace will provide us, and that will be very helpful. Also seen from a Danish point of view, from where around in Europe can we learn more, but also where can the knowledge that is developed and experience developed in my country, where can that actually be more precisely be put out so that others don't have to make the same learning curve as some of the colleagues in healthcare did in specific specialities. So yeah, that's what I hope, Susana, to see happen.
Muchas gracias. Estamos justo en el tiempo que nos habían asignado a este panel. Yo quiero pasar mi turno de palabra a Jacqueline, porque seguramente ella tiene más preguntas que hacernos o quiere guiarnos en lo que los oyentes han dejado en el chat.
Yes, I do actually. So before we move back into the word cloud, there's a question, a burning question, which is the role of, I'm looking at the wrong one. So how can we harmonize evidence and practice-based treatments for patients throughout Europe? So panelists, what's your opinion on this? How can we harmonize evidence and practice-based treats? How would the European Health DataSpace, for instance, I know the answer is going to be national plan, but somebody within the audience was wondering that. Jennifer, I see you smiling.
Yeah, because it's such a great question. I think it's just so fundamental. If we view obesity as a disease, we will start recording it properly and really looking at the disease progression, the treatment, and the management. And once we have this data, we can establish what is or is not the most effective. And based on that, then we can start the harmonization for the treatment and management in the patients. So I think it comes back to really data quality, accessibility, and recording, and of course the understandability in the national plan.
Indeed. And I have another question which has come up in the chat actually, which is what is the role of obesity education directed to healthcare professionals to make possible data registries? So in effect, you know, how can we, or what's needed to educate health professionals, statisticians as well, in order to make sure that the right data is actually being collected in the right way? I guess I'm going to ask that to Michele as a dual, and also Federico, if you'd like to take that one briefly. Michele?
Sure, thanks, Jacqueline. Well, I think education for health professional, broadly defined, is a key instrument to make sure that we can we can collect high quality data that are cross-country comparable. So on this point, I think that investing more in education, both for the healthcare professional, but let me also add health literacy for the general population, is certainly something that we need to invest more. But I would also like to take this opportunity to respond quickly on the first question. There was how we can ensure cross-country comparable data and the harmonization of data. I think that cross-country organizations, such as in this case, when it comes to medical things, WHO, and when it comes more to statistical related things, Eurostat, or I also include OECD, can play a role in helping countries find among themselves the good way of harmonizing. Because when it comes to harmonization, most of the trouble is really to make sure that everyone across the various countries is happy with the definition that is given, and it's also possible to implement it. Over.
And Federico, yeah.
Yo quería comentar un poco también lo que ha dicho Michele, que educar sobre la obesidad en los especialistas y educar sobre que la obesidad no es solamente un problema del paciente, sino que esto es un problema que hay en la sociedad en general, porque y desde la experiencia de los pacientes, una de las cosas que nos encontramos muchas veces es el propio estigma y la estigmatización hacia las personas que viven con obesidad, por el simple hecho de la frase de cierra la boca y muévete más. Por poner un ejemplo de una frase muy común dentro de los especialistas de la salud, que también nos encontramos grandes personas involucradas y concienciadas con este tema, pero hay un porcentaje alto de personas y de especialistas que no están concienciados y que no... por eso es evidente también necesaria la educación también en ese sentido, en la estigmatización y el porqué y el aprender todos de la obesidad, porque todos tenemos que aprender y todos tenemos algo que aprender seguramente.
Great, so I hand back over to Susana.
Sí, no, muchísimas gracias por vuestras intervenciones, porque realmente es como aprendemos, ¿no? Hay cosas, lo que decía el Federico, de que la obesidad no es un problema del paciente, ni que se soluciona solamente con nutrición, ¿no? y ejercicio, sino que también necesita otro tipo de tratamiento, a lo mejor atención psicológica. A mí me ha encantado cuando conocí a Federico, ¿no? Que me habló de la atención primaria, lo que hacía ahora era esta dieta fotocopia que sacaba a cada uno de los pacientes sin que esté personalizado, pues es muy importante. Me queda claro que necesitamos datos, que son necesarios y que desde luego el espacio europeo de datos es ahora la oportunidad. Gracias por vuestras contribuciones y ahora que vamos a legislar sobre ello, pues os necesitamos más que nunca, ¿no? Para que nos guiéis en nuestro trabajo como legisladores en el Parlamento Europeo. Muchísimas gracias a todos. Y paso.
Excellent. Thank you so much, everybody from this panel. It's a great start to the full working year, put it that way. Moving on extremely briefly so that we can move into the next panel. So you've been asked the question along the way, what do you see as the biggest challenge related to data on obesity in Europe? Please keep on filling in. I think we've got, so not enough relevant data is collected, data beyond BMI, access to data, breaking prejudice has been added on, lack of data, period, in Eastern Europe, and changing definition of obesity. That's a lot in itself. So I think a number of the points which have been raised already during today's session, I think address some of this, but the question is, where do we go from here? Access to primary healthcare, indeed, and the linkages between. So the question is, where do we go from here? How do you take all of the blue sky thinking, so to speak, from the first session and move it into what can become a call to action from European parliamentarians. So with that, I'd actually now like to hand over to Pernille to chair our next session, all about where do we go from here. Pernille.
Thank you, Jacqueline. And I hope that you can hear me, because now you have helped me to be unmuted. I guess so. Thank you so much. And thank you also for the good session just before. Thank you so much, Susana, for sharing that. So now we take it there a step more into the deep of the concrete recommendations for us as policymakers. And I'm very happy that we will have on the panel Kremlin Wickramasinghe. I hope I pronounced your name not precisely, but almost. You work at the WHO, the European region, and you are always with us whenever you can, and that is very, very helpful. It's very important for the EU to put everything that we do into a global perspective, and that is where WHO comes in as the pro. Also, I would like to welcome Birgit Bauer, the patient expert and also a person living with multiple sclerosis. I'm very happy to see you in this session. And third but not least, my colleague Susana Solís Pérez from Spain and from the liberal group Renew and the vice chair of the interest group. So that will be the three of you taking the extra steps of concrete recommendations. And I would like to start with you, Kremlin, because WHO has been working with COSI, which is the Childhood Obesity Surveillance Index, for over a decade. So what is the key learnings on how to evolve COSI to take into account the full life course of obesity and as an NCD? And aligned with the other data's surveillance, what can we as Europeans working with the health data space architecture, what can we learn from COSI in this regards? So please, the floor is yours for maybe 3 minutes or so. Thank you.
Thank you. Thank you so much. Thank you for the invitation to WHO Regional Office for Europe. We are delighted that you are taking this discussion forward. It's very important for our work to have better data in the EU countries and across the WHO European region. As you know, WHO European region is 53 countries, so goes beyond the European Union countries. So I will take some lessons we have learned from other countries as well during my next couple of minutes. As you know, COSI, we have in more than 40 countries in our region now, and we have 26 EU countries except Luxembourg now collecting nationally representative data. So from COSI, we have learned and also we have demonstrated the importance of having high quality measured data from representative national samples. And the second part is the importance of doing it jointly with national stakeholders. For COSI, each country has a principal investigator nominated by the government, and we do it with that team, PIs who are driving that process, so they can continuously make improvements. They can review from every round to round what can be improved, because there are a lot of recommendations coming. Everyone wants to collect all the data, and the people who collect data knows what's our feasibility, what are our resources, what can we do to give the best results. And those are very difficult decisions, and you can only do it well if you do it with the national stakeholders who are involved in that process. So from COSI, that's my first lesson. That is, how can we collect measured, good quality, nationally representative data from all the countries? We need data more than the 6 to 9 years old. COSI stands for Childhood Obesity Surveillance Initiative from 6 to 9 years old. Very important period, but not enough when we consider the whole of life course approach. We need good data for under 5. We know that data exists here and there, but to bring them together and have good data for preschool children in a usable format is important. And when we go to adults, about adult obesity, the European Health Interview Survey is currently mandating only self-reported data, not necessarily measured data.
I think if we learn what we learned from COSI and apply that to adults, one of the first thing we could do is have measured data for adults in the EU, and that will take us a very big step forward. But we recognize measurement of height and weight is not sufficient. We need to have the other indicators that you heard previously, and we need to look at the others that we need alongside those heights and weight measurement. And it's a different discussion what we can collect and how much facilities we have and how to train the staff to do that, but we need to go beyond that. We can see that in Eastern European countries, non-EU countries, with WHO, they have implemented the WHO stepwise survey, step survey. And with that, we have measured data for adults and also other measurements, biomarkers, blood pressure, lipids, and glucose. And with COSI and STEPS, they have better data across the life course actually than some of the EU countries now. So it can be done. That is my message. We can have measured good nationally representative data, and we know how to do it, but we need to put these pieces in the puzzle and system together to make it happen. My last point is that we had a conference on how to use digital solutions to tackle non-communicable diseases in February. And in that conference statement, we recognized the digital environment as an important determinant of our NCDs, and how can we look at the digital environment, which has an impact on obesity, digital food systems, marketing, and all of that. How can we then collect data about policies related to digital environment also? And going beyond that, policy implementation data related to obesity, we need to collect good policy implementation outcome data. Why the breastfeeding is lowest in our region, we need good quality data to look at it. And then health system response, of course, whether patients living with obesity, are they getting the recommended treatment, and how can we collect data to look at the health system response. So I think with that, I conclude the importance of having measured data on obesity, as well as good data about the policy response and policy implementation. Thank you.
Thank you so much, Kremlin. Very informative and very also condensed recommendations for us to go forward with. And I guess that there will be some questions to you after this short round of questions, where I will now take myself and us to you, Birgit, as a stakeholder and as a person living with multiple sclerosis. What do you see as the main advantages of the European Health DataSpace for people living with NCD, a non-communicable disease? What will be the areas to focus on? Please, the floor is yours.
Oh my God, I have such a long list, to be honest.
Yes, but you can speak now. Please do.
Yes, I do. No, I'm coming from the perspective as a chronic, as a person living with a chronic disease now, and I think that's important because we need that data because of research and development. When we have good quality data, we can do more R&D. That means also that we can find out more about the disease itself. What does it mean? What can people do? How can we find better treatment or care, whatever? There is so much around a patient, and to unlock the data would mean also to help patients to have a better disease management, to find better care, to have better care at the end, and also to learn more about our diseases. This is what also Federico has stated in the other discussion. Patients must be informed, because it's also about prevention, or also to have a faster diagnosis. And as I was diagnosed, I can say it from my own experience 17 years ago now, I was not informed about how to live with MS. I had to find it out. And there was no information. And when you fall into this black hole, you don't have any help, but data can help. And in times when we talk about patient centricity, personalized healthcare, and all that stuff, we need that data also to personalize healthcare indeed, and also to give experience to the newly diagnosed ones also, and also to the beloved ones, how to deal with that situation. And that's why we need data. It's a very practical point of view from my side at the moment, but also to solve that stigma Federico has mentioned, and I couldn't agree more, because we as patients are mostly stigmatized. And knowledge and data about a disease can help to solve that stigma, and also to help us to have a good quality of life and a normal, almost normal life. So my blog is called my almost normal life. And this is what we need. We need a normal life in the framework of that way we live in the framework of a disease. But that's why we need data too, not just for research and development and for the scientists. We need it for the people, because data can save lives, as the project says.
Thank you, Birgit. I got this image from listening to you, that you are actually describing the data space as a kind of an ecosystem, because the raw data needs to get in, and the output has to be directed to research and development. So there will be a lot of data crunching and data analysis and extrapolating, but also that data needs to be understandable for the ones who put the data in order to be able to understand the dialogue between what do I do and what do I get out of that. But also, and that was, I think it was a very important message from you, that it's not only the citizens, the patient carrying the diagnosis who needs the data, it's also the families. And I would like to take it a step further. It's actually also the colleagues. It's your boss. It's your peers. The data also has to be part of the work-life balance circus in society, because maybe sometimes it's a good colleague who can address a question to you because the one is empowered by the data they already know about your diagnosis to be helpful and also to keep up the good spirit that I think also many people living a life with this sometimes also severe chronic disease, they also sometimes need a little neighbor love from others to get back on track and carry on. And at least we see that very much also in the area on obesity, because as also said in the previous session, there are so much stigma still in that area. So thank you so much, Birgit. I guess there will also be questions for you coming up from the chat. The last one in this round, Susana, dear colleague, what are the elements that we as policymakers would like to prioritize, you think? And also maybe you can mention some of the dossiers that you think of, besides from the health data space and the upcoming legislative framework in the pharma strategy. What else is in the action plan for us to work with, Susana?
Bueno, pues como tú sabes, Pernille, estamos en un momento clave en el Parlamento Europeo, ¿no? En el 2022 va a haber muchísimos expedientes legislativos. Y efectivamente, no solo el Espacio Europeo de Datos Sanitarios, sino que también tenemos la Ley de Datos, acaba de aprobarse la Ley de Gobernanza de Datos. Vamos a hablar mucho sobre cómo podemos avanzar en esta Europa digital. Y algo que me parece fundamental aquí, que antes también alguien en el chat lo sacó, es la privacidad y el uso seguro de los datos, ¿no? Y en el Parlamento estamos muy preocupados porque esos datos se utilicen de una forma ética y de una forma confiable. Al final, los pacientes van a ser los que van a ceder sus datos solo si saben que eso es de una forma confiable, de una forma ética, y eso es algo que vamos a trabajar mucho en el Parlamento para que así sea, ¿no? Yo creo que también otra cosa importante es que en todas estas legislaciones que van a llegar aquí al Parlamento incorporemos ya el lenguaje de la obesidad como una enfermedad no transmisible, ¿no? Cambiemos el diálogo y que en cada uno de estos informes que lleguen seamos capaces de, y tú lo sabes, cómo importante es que metamos una enmienda o que incorporemos en el debate el lenguaje de la obesidad, ¿no? Y ya desde el principio, yo tengo que decir que algo muy importante, y por eso es tan tan valiosa la reunión de hoy, porque siempre en esos intercambios que hacemos con los comisarios, con otros MEPs, con otros stakeholders, ya introduzcamos y ya preguntemos por el tema de la obesidad. Eso es un trabajo que ya podemos hacer a partir de ahora. Y bueno, yo creo que luego que también hoy tenemos muchas ideas de cómo podemos trabajar juntos, cómo podemos exponer preguntas a la Comisión y abrir el debate en las instituciones europeas. Y algo muy importante que yo creo que ha salido hoy y que debemos hacer es esos estudios en cada país para que tengamos datos comparables, ¿no? Y yo, bueno, pues me comprometo aquí a hacer ese estudio en España y que podamos al final, lo que decimos, ¿no? La obesidad se puede tratar si realmente tenemos estos datos que vamos a conseguir entre todos.
Thank you, Susana. Now let me know, Jacqueline, is it now that there is some questions from the chat?
Yes, there are. So,
perfect.
Yes, I know. And I also think that Jennifer and Birgit may also want to come back in as well in terms of what's going on in their own country, so Germany and Denmark as well. So we have a comment actually, a couple of them. So we've got, we shouldn't forget about hidden obesity in populations. So not only to those who show up at their GPs at hospital as patients. So I guess if we were to convert that into a question, we go back to how can we, moving forwards, how can policymakers and particularly the Parliament push to make sure that different types of obesity are actually registered in any one way? Because as we know, sometimes you know, for somebody's BMI, it doesn't even show up if, for instance, it's visceral obesity. So, but your organs are being suffocated at the same time. So that's one question for the panel. And also, well, actually, no, I'll leave that there. And also for Jennifer and Birgit, one of the points that the European Commission has been very clear about moving forward in all of their policy initiatives coming through is the need to engage with national member states. So what would be your experience so far, the good, the bad and the ugly? What would be your experience so far in terms of getting the your national member states to engage on these types of topics, and what advice would you give to all of us on this virtual meeting? I'll start with, I see Birgit is highlighted, so I'll start with Birgit, then move to Jennifer.
That's a really hard question, to be honest, because sometimes we discuss too much and we don't do anything. So I want to come from the discussion to the activity, to be very honest. Sometimes I'm fed up because, oh, we have to discuss this. This is something I hear so often. And I always start thinking, hey, can we start the activity now? This is important. And I also would give the advice that the governments also bring in the patient organizations and the independent patients into panels to give advice how to create that, because they are the persons who are directly living with the disease, and they know how to do it. And maybe you know the phrase, patients know best. So this is one thing. And the other phrase is patients involved. This is the other thing. So I need an expert advisory board to bring it on and to move it forward, because you need that voice, because it's so important to hear what the citizens say. I also would bring in citizens, because it's not just the people who live with the disease. It's about us, it's about the whole population, and this is important. It's not it's not a thing from experts, and in Germany we discuss that very often on an expert level, but the message doesn't come to the patients or the citizens, and this must be changed. And we have also to unlock the data, and in Germany we have data still locked and they can't be used. We don't have access to it, and sometimes for me it can be a failure to render assistance when we don't unlock that data to help other people living with chronic diseases, and that must happen because it's so important. And I think that's the deal. Create an app board, unlock the data which are locked at the moment, and find ways to communicate better, because citizens are not informed, and we have to change that. We need more health literacy and also data literacy in all countries, I guess.
Yeah, absolutely. Jennifer.
Yes, well, I couldn't agree more with Birgit. Sometimes we talk too much and definitely do too little. In Denmark, we have one really positive aspect. Our data are unlocked. We are able to access them for very timely analyses for the good of research, for industry, and for the citizens. So we have that covered. But in Denmark, we also have very strong opinions, I would say. So we also like to reach consensus, and that hasn't really happened when it comes to the case of considering obesity as a disease. So I think to sort of buy into the bigger program, to really hit the EU level with this, I think within Denmark, we need to find our own way forward first, quickly, rapidly, talk less, do more. And then I think we can go along further with this. But the only good thing, and I will highlight this again, the data are there, they're available, they're recorded. So we're getting some things right. And of course, everybody can do something more. So thank you.
Pernille, you have your marching orders. So for the Danes, what can I say?
Yeah, that's true. But I was also thinking that maybe to address the question of what is needed and how to engage more policymakers and clinicians and citizens in this topic here, we also need to address the data in a way that that you could say citizens not in their own surrounding having obesity or another chronic disease close to their heart, that they actually understand, why is this still important for me? So how can we also translate the data on resilience to make others understand actually what is the output of the taxpayers' money and the political energy that we put into this topic? Then it's not only a matter of, and as being a nurse, it's very dear to my heart to have the ethics high up, and also as a European to have our values high, but also that it's about how to keep the union strong. It's about the economy, also the resilience in our productivity, and we get fewer and fewer people, we get elder and elder, and now we also get more and more obese, and that is actually creating a Bermuda Triangle for Europe, and we need to be aware of that, no matter if we actually carry or our neighbor carry some kind of diagnosis to be addressed. I would say that could also maybe spark some of my Danish colleagues from a lot of sectors to engage more in how to co-create in the resilience of the union.
I see Federico's hand gone up as well.
Sí, solamente que en esto de ver cómo conseguir que los dirigentes se basen en datos, o cómo conseguir esta mayor fuerza hacia que se registren datos, es que, por ejemplo, en España muchas veces nos pasa que quieres que, oye, mira, es necesario o sería muy beneficioso que la obesidad se considere una enfermedad crónica, porque conseguirías reducir gastos de esta manera o así. Y te dicen, ya, pero dame los datos. Entonces es como esa coletilla, que se muerde la cola, como diciendo, es que me estás pidiendo algo que no se puede lograr porque no lo estáis considerando una enfermedad. Es como esa vuelta de tuerca que es necesario conseguir para que todos... es como la respuesta fácil a no quiero meterme en un problema más grave.
Yeah, great. I've got a couple of questions. I have a couple of questions from the Q&A. So going back to Birgit and and Pernille's earlier points about information on, or lack thereof, once you're diagnosed, there's a question probably best to Kremlin, Michele, and Jennifer in the ether. So is there, so it says on how to adjust, sorry, so there seems to be very little information when one is diagnosed with a chronic disease on how to adjust your diagnoses. But there's also a huge issue on how you're treated once you're considered to have pre-obesity or obesity. Is there any data on this in terms of ongoing treatment at the moment, or is this something that EHDS will have to address?
Do you want me to start, Jacqueline?
Yeah, please.
Thank you. I think there is some data done at research settings level and hospital levels, but not through national surveys, largely as we would like to have. And I recognize the importance of such data, not once you are even diagnosed, even before that, right? We are also interested in prevention. When someone comes, do we offer them counseling on healthy diets or quitting tobacco or alcohol, whatever, and do we collect data on that? And if we have these diseases contributing to 80% of the deaths and 90% of the disease burden, I ask a question in many meetings: has your GP initiated the discussion in the last 5 years when you visited your GP on these issues without you going for it? And often nobody has come across that experience. So if our health system is not initiating that dialogue for 90% of us, when we come across with our health system, there's something really wrong in the way we look at it. So I recognize that we need to collect data, and also we need to somehow use the data to really change the mindset from both sides, our population and our healthcare providers. And we have been interviewing both primary healthcare professionals and some patients recently to understand how to improve it. One of the issues we know, I think you talked about the trust about the data. So I'm not going into it, and patients say, yes, it's good, but if the data can be trustworthy and if we know what happens to the data. Another issue coming from primary healthcare professionals is that patients are so busy, they come to us for a specific thing, and I want to make sure their interests are protected. And if it seems like I'm initiating unnecessary discussion, they might not be happy. So I think data can help us here. So patients also know that GP or your doctor or your nurse, primary healthcare professional is using the time for an important issue for you and for the society, not wasting your time by initiating that discussion. So I see the challenge both for collection of data and to start that conversation, because from health system things, we are taking unnecessary time from the patient and it's a burden on them. So how we use data to buy in from all sides is going to be the challenge. But I completely agree with the need for such data. Thank you.
Wonderful, extremely insightful. I'm going to bring in Michele very quickly because we're about to have to close, unfortunately. But Michele?
I will be super quick, but as you called me, I thought I should chip in, and I have first-hand experience I can share on the need of this data and on the availability, but the very difficult process to get access to this data. As part of an EU-funded project, we are trying to get access to this data and calculate what is, for example, the extra cost that obesity has on other comorbidities and other clinical conditions. And doing this in the EU is super difficult because this data is usually owned by second-level administration countries. So, for example, for Spain, we are talking with a few regional governments. In Germany, we are talking about with different social insurance funds, and finding an agreement to get access to this data across all these more than 300 potentially different administration is a nightmare, while the initiative that we are discussing today, the European Health DataSpace, would essentially make this work for us, and that was what I was referring to at the beginning. But these data exist, they can be improved. Of course, the quality in some cases is an issue. Most of the work is really to make them together, to put them together. Over.
Hello. I'm handing over to you now.
To whom? To me?
Yes, I do believe so.
I actually have one chronic disease that I know of, namely that I am deaf. I have sudden deafness in one ear and a lot of tinnitus. So I didn't actually hear the first part of the name you mentioned, Jacqueline. Sorry for that.
It's okay. It's okay. So Pernille, I'm handing over to you to draw conclusions and close this panel.
Oh, thank you so much, Jacqueline. Well, my conclusion is that now Susana and I, together with you, Jacqueline, and your team and Open Obesity, that we have a lot on our table, on a lot of different post-it notes that we need to put together, both in terms of a kind of an action map of what to do, but also I would like to suggest that we go over what have we sent as letters to the Commission from the European Parliament, where we address some of the topics and thoughts and ideas that has the relationship to both obesity, health resilience, and the need for obesity to be recognized in all member states as a chronic disease, as well as also the many important inputs for the upcoming legislative proposal on the health data space. I think, Susana, it would be very good if we can actually see if there is a need for an updated, precise letter to the Commission so that we help them to cover every needed aspects in their proposal so that we can continue the work from that on. But also, I would like to inform you all to stay close to the SOME channels of EASO and Open Obesity, etc., as well as also the social media channels of you, Susana, and myself, because we will make a study trip in February in week 8, which is the Green Week of European parliamentarians, where we are allowed to participate without not being present in the legislative work. We can be in our constituency or elsewhere in Europe to go closer in dialogue with citizens and experts and healthcare professionals, and we intend to do so, actually making a study trip on obesity in the first 2 days of week number 8. So stay tuned and also let all your knowledge and ideas and questions flow to us. Thank you so much for being with us this morning. It was a great Monday to start with, and I think that we will all in this community focused on health resilience and obesity. We have had now a very good start for a splendid 2022. Thank you so much. And now I hand over for you, Susana, to have the very final comments from our side, from the European Parliament. Thank you so much.
Muy rápidamente, daros las gracias a todos por vuestras aportaciones en la sesión de hoy, por este fantástico debate que hemos mantenido. Y como ha dicho Pernille, hoy hemos aprendido mucho y lo que hemos aprendido nos va a servir de gran utilidad para apoyar esta causa en el Parlamento y también en nuestros países. Creo que no nos podemos seguir quedándonos de brazos cruzados. Ahora es el momento. Y yo quería dar las gracias a Jacqueline y a todo el equipo por su pasión y por su involucración, porque ya nos han puesto trabajo por delante, tenemos muchísimo trabajo para este año y vamos a tener que trabajar duro, pero no me cabe duda de que los resultados harán que vuestros esfuerzos merezcan la pena. Gracias por esa pasión y, como decía Pernille, vamos a empezar con esa carta a la Comisión Europea, vamos a exponer las ideas que hemos debatido hoy, vamos a realizar la carta. Y también otro tema que no he hablado, pero creo que es interesante, es el coste de la no acción, ¿no? Que tengamos, como en política necesitamos tener estimaciones sobre el impacto económico y pues necesitamos un estudio de impacto sobre el coste de no hacer nada. Se habla del 7% del PIB, pero tenemos que tener este coste real y pedir ese estudio aquí dentro del Parlamento Europeo. Así que quiero invitaros a todos a contar con mi ayuda, con la de mi oficina, y encantados de poder trabajar en el futuro con vosotros. Es un placer, con Pernille, pero también con todos vosotros, que ha sido un placer. Gracias.
Thank you so much. And on that note, I think we can close the meeting. Thank you to all for your really enthusiastic participation. It's already been said, we have a lot to do, but thanks to the great insights from institutional actors, as well as the scientific stakeholders, patients, I think it's safe to say that we're very much aligned in terms of what we think our ideal world will look like. Now we can stop talking and actually get on with it. So thank you all. Have a great rest of today and enjoy your lunch. Thank you. Bye-bye.
Bye.